is Dr. Lyell Jones, Editor-in-Chief of Continuum, the premier topic-based neurology clinical review and CME journal from the American Academy of Neurology. Thank you for joining us on Continuum Audio, a companion podcast to the journal. Continuum Audio features conversations with the guest editors and authors of Continuum, who are the leading experts in their fields. Subscribers to the Continuum Journal can read the full article or listen to verbatim recordings of the article by visiting the link in the show notes. Subscribers also have access to exclusive audio content not featured on the podcast. As an ad-free journal entirely supported by subscriptions, if you're not already a subscriber, we encourage you to become one. For more information on subscribing, please visit the link in the show notes. This is Dr. Lyell Jones, Editor-in-Chief of Continuum, Lifelong Learning in Neurology. Today, I'm interviewing Dr. Ariane Lewis, who recently served as Continuum's guest editor for our latest issue on neurocritical care. Dr. Lewis is a professor of neurology and neurosurgery at NYU, where she serves as the director of the Division of Neurocritical Care. Dr. Lewis, welcome. Thank you for joining us today. Why don't you introduce yourself to our listeners? Tell us a little bit about yourself.
Thanks so much for having me, Dr. Jones. It was a pleasure to be an editor of this issue, and I'm really excited for it to come out. As you mentioned, I'm a professor of neurology and neurosurgery at NYU. I'm also a fellow of the American Academy of Neurology and a fellow of the Neurocritical Care Society. I serve on the Ethics, Law, and Humanities Committee for the FAAN. I was a past chair of the Ethics Committee for the Neurocritical Care Society and also the past chair of the Ethics Committee at NYU.
So pretty diverse professional interests, and I was going to ask you about the ethics. That feels like something that ties in pretty well to neurocritical care. I imagine that expertise comes in handy, right?
Yes, absolutely. My area of expertise is related to brain death and ethical, social, and legal complications related to brain death determination.
Got it. And when we were talking before we started recording here, you're from the New York area and a lifelong Yankees fan. Is that right?
Yes, that's correct.
How are they going to do this year?
Oh, we're hoping we're going all the way.
Okay.
In a while.
Our listeners heard it here first. So the issue, let's get into the neurocritical care topics. Phenomenal issue, full of detailed diagnosis and management strategies for patients with, all manners of severe neurologic disorders requiring critical level of care. With your perspective, which is a unique perspective, you've just edited a full issue on neurocritical care. You got to delve into all the topics. What were you most surprised to learn, Dr. Lewis?
Well, I think that one of the most exciting things about this issue is the fact that in addition to dealing with the typical topics related to neurocritical care, like hypoxic ischemic brain injury and stroke and intracerebral hemorrhage and subarachnoid hemorrhage, of course, the issue delves into some very unique topics related to neurocritical care. There's an article written by Dr. Barry Seisler that focuses on emergent management of tumefactive and aggressive demyelinating disorders. Dr. Casey Albin wrote about neuromuscular emergencies, and Drs. Maciel and Bussel wrote about neuro-onc emergencies. And I think that these areas are really important areas for neurologists and trainees to know about, and they're not talked about all that often. And these topics are often focused on, of course, by other subspecialties, but the perspective of a neurointensivist related to these topics is infrequently addressed. So I think that these are really the most exciting aspects of this issue because it's something so unique in terms of the spin on these topics.
Fantastic. And what else can we look for in this issue? What other topics can our listeners and readers expect to find there?
So the issue starts off with the examination and workup of the neurocritical care patient. Dr. Sarah Walster and Nick Johnson from the University of Washington did an awesome job really bringing the reader into the topic of neurocritical care as they address an overview of neuroemergencies, red flags related to life-threatening conditions, herniation syndromes, vascular territories, and mechanisms and management of acute neurodeterioration. And they summarize monitoring modalities in neurocritical care and clinical and radiographic scales and scores that are commonly used in neurocritical care. And that's a really nice overview to introduce the reader to this issue. The rest of the issue focuses on a wide range of topics pertaining to the emergent management of neurocritical care issues, including hypoxic ischemic brain injury, which was addressed by Dr. Steinberg from the University of Pittsburgh, management of stroke due to large vessel occlusion, which was addressed by Dr. Leslie Mazui from the University of Washington, management of ICH, addressed by Dr. Murthy from Weill Cornell, and then also management of spontaneous subarachnoid hemorrhage addressed by Dr. Sujin Park. Dr. Cleo Robinos addressed emergent management of status epilepticus, The emergent management of TBI and spinal cord injury was addressed by Dr. Podell and Dr. Morris from the University of Maryland. And then neuroinfectious emergencies, which again is another unique topic in this issue, was addressed by Dr. Reynolds from Mount Sinai. And then the issue concludes with a paper that focuses on prognostication in neurocritical care by Dr. Suzanne Muschlegel from Johns Hopkins University.
Yeah, and what a great list of authors and expertise. And really, having seen these articles, really just phenomenal guidance on a lot of different subtopics. And I imagine, this is a dynamic area. There's a lot of evidence, but, sometimes there are controversies or debates or unresolved questions in the field. Having just reviewed and edited the issue, what do you think the biggest debate or controversy is in neurocritical care right now?
So there's definitely a lot of controversies that are addressed in each of these individual articles. For example, in the paper on subarachnoid hemorrhage, Dr. Sujin Park provides a summary that compares the guidelines on management of subarachnoid hemorrhage that were written by the Neurocritical Care Society and the American Health Association, American Stroke Association in 2023, and really walks through what's similar and what's different between these guidelines. For the most part, they are very similar, but there are areas of differences. Additionally, in terms of management of acute neuroemergencies related to neuromuscular issues, in some cases, it's not clear whether to treat patients with IVIG or with plasmapheresis. Dr. Casey Albin creates a nice summary addressing these issues in terms of what are the pluses and minuses associated with each of these medications. Additionally, there are a number of novel therapies that are not traditionally considered for various neuroemergencies that are walked through in each of the individual articles. For example, in the paper that focuses on management of status epilepticus, Dr. Rubinos addresses alternative therapies like immunomodulatory agents or neuromodulation for management of superrefractory status epilepticus. So I think in addition to addressing the more traditional therapies for various neuroemergencies, the issue really goes above and beyond to address novel interventions.
That's fantastic. And obviously, it continues to be a rapidly evolving area. When you look out to the horizon and the next generation of care for patients with critical neurologic illness, what do you see on the horizon? What should our listeners and readers be aware of to watch out for?
So I think one thing that is really important to be aware of related to patients with neuroemergencies is the Curing Coma campaign, which is organized by the Neurocritical Care Society, which focuses on research in terms of improving the clinical management, the prognostication, and the care of patients, and addresses the goals for improving recovery for patients who are comatose. And obviously, coma can be due to a wide range of different etiologies, many of which are described in this issue. And so I think that their work as we move ahead will be incredibly important and interesting to see how things evolve in that domain.
We will be on the lookout for the Curing Coma campaign. Sounds like a great initiative. And I think, medicine is a team endeavor, right? We were talking about the Yankees earlier. Baseball's a team sport, so is medicine. When you think about the importance of teams, it's hard to imagine a setting where it's more critical to have, well-functioning teams than in the neuro ICU. But there's also parts of the team, people on the team who are outside the neuro ICU. And I'm thinking of other neurologists, our listeners and readers who might work in the inpatient setting, but not in this really specialized environment. When you think about those neurologists, is there a key message for those hospitalist neurologists or inpatient neurologists that you would want to share from your perspective as a neurocritical care specialist?
So I think it's imperative for all neurologists to have an understanding of the existence of various neuroemergencies and the identification of when a patient is having a neuroemergency so that they can escalate the management if it's something beyond their skills or expertise to somebody who is capable of appropriately managing the patient. Each of these articles walks through the differential diagnosis, the identification of the neuroemergency, the first steps in terms of management, the laboratory workup, and then the subsequent steps as well. And I think that, for all neurologists, really the key things to know about, even if you're not specializing in neurocritical care, is how to identify a neuroemergency and what needs to be done as the first steps in terms of intervening, diagnosing these emergencies.
Great message. And that's one of the key things we learn in training, right? Is when to recognize that someone's sick and you need to escalate their level of care. What about, I imagine the neurocritical care field is a relatively small community and you know a lot of these folks. Any key message that you would want to share with that audience?
So I think that this issue is still really important for all neurointensivists, in addition to for general neurologists and trainees, because of the fact that every article really addresses in depth each of these aspects of neurocritical care and provides tidbits of information that not every neurointensivist would know. So I think that the issue is beneficial both for trainees, general neurologists, and people who have expertise in the field of neurocritical care.
That's a great point. I think the fact that it is such a rapidly changing and broad field, you mentioned all the different article topics that are in the issue. It's a challenge to stay up to date on everything. And I think that's what this issue really brings to the neurointensivist is, this is all as of what's the latest in 2024 for the care of patients with critical illness. It's all there, right?
Absolutely. I think, the issue is unique because neurocritical care is unique in that our role involves taking care of patients with a wide range of different neurologic disorders. So the issue touches upon stroke, both ischemic and hemorrhagic. It touches upon seizure management. It touches upon management of traumatic brain injury. It addresses demyelination, so types of aggressive MS and other demyelinating disorders, neuromuscular issues, neuro-onc issues. So I think that really there are so many subspecialties within neurology that it's important for them to have awareness of the emergencies that can emerge within their individual field.
So we know that neurocritical care is pretty specialized work. And I imagine the expertise and the resources are not necessarily going to be available in every community. Are you aware, Dr. Lewis, of any disparities in access or outcomes to neurointensivist expertise?
Yeah, absolutely. Unfortunately, as you look internationally, first, there are many places that don't have neurointensivists. So patients with neuroemergencies are being taken care of, in some cases, not even by general neurologists, but by specialists just in medicine. Additionally, the resources are often not available in terms of having an intensive care unit, having nurses with a good ratio to care for neurocritical care patients, having access to therapists who can participate in rehab and promote rehab for patients, having access to medications that are necessary, having access to various interventions, such as access to neurosurgeons who can do neurosurgical procedures, or placement of an external ventricular drain or other monitoring modalities are not available and accessible. So all of these issues in terms of resources, in terms of funding, in terms of other issues related to the existence of protocols as to how to manage patients in the neuro ICU, all impact the outcome for patients in neurocritical care. Additionally, social issues and cultural issues can impact the outcome for patients in the neuro ICU. So there's a lot of issues pertaining to equity in terms of the management of neurocritical care patients around the world.
Those are great points. I know you and I both work with trainees in our field. And when I talk to residents who are interested in, neurocritical care, I think part of what draws them in is when they are exposed to it and they see how much, the value of what their expertise brings to the outcome for that patient. I mean, it really does make a difference to understand the brain when you're caring for people with these critical neurologic disorders. And I think that's part of the appeal, right?
Yeah, absolutely. I think that people who are interested in going into the field of neurocritical care are interested in the more fast-paced aspect of neurology, rapid decision-making, dealing with emergencies, also dealing with prognostication, discussions, unfortunately, at end of life. So that's really the kind of individual who turns to the field to specialize in.
And what about you, Dr. Lewis? What drew you to this, pretty high pressure, intense, dynamic environment?
So I think actually, all the buzzwords you just used are really the things that made me want to go into neurocritical care. I am interested in much more fast-paced management of patients. And, unfortunately, obviously, emergencies happen, and I find them to be exciting to be able to manage patients in that setting. And, as you mentioned earlier, in the neuro ICU, it's a very multidisciplinary team. And I really enjoy being able to work with nursing, social work, care management, therapists, a variety of consultants, and addressing very acute issues with these individuals as a team in the ICU setting is really very rewarding.
Yeah, and I hear that from others who are drawn to the field. And I think you really have to have kind of a broad skill set to manage actively critically ill patients, but also do the communication competencies and other things that are necessary. So anecdotally, I would say I see more interest among trainees in this field. I don't know if you've seen the same thing in your world.
Yeah, I think that, as you mentioned, it's really important to emphasize that being a neurointensivist does not just require expertise in the medical aspects of care for these patients, but really also it's very important to ensure that we promote education related to communication and neuroprognostication. So our last article in this issue by Dr. Suzanne Muehlschlegel addresses prognostication and includes a variety of different details about how to address uncertainty, how to implement family and patient-centered prognostication and promote shared decision-making. And these topics are so important for everyone to know about when they're communicating with patients and families to address goals of care and to prognosticate.
Yeah, thank you. And before we wrap up our discussion here, Dr. Lewis, in addition to being a neurointensivist and being an expert on ethics and all of your clinical and research work, you do editorial work. You have editorial responsibilities not only for this issue of Continuum, but also at seminars in neurology and at the Green Journal. For our listeners who might be interested in that career pathway, how did you get into that?
I very much enjoyed writing, and so I published a lot. And then I think that, making connections is incredibly important and really looking out for those types of opportunities. Once you build a semblance of expertise in an area, then that often tends to lead to opportunities. So I'm a deputy editor for the Disputes and Debates section of the Neurology Journal. I'm also a deputy editor of seminars in neurology. I edited a book with Dr. Jim Burnett on advances in neuroethics related to death determination by neurologic criteria, areas of controversy and consensus. And then I've also been a guest editor for a number of other journals like the AMA Journal of Ethics that focused on socially situated brain death, a neurosurgical focus issue on primary and secondary infections of the brain, and a issue of seminars in neurology focused on ethics in neurology.
You must have like a 28 or 29-hour day, Dr. Lewis. I don't know how you do all that. I wasn't even aware of all those things that you do, but I can tell you, having looked at this issue, your editorial skills are off the charts. I really want to thank you, not just for a wonderful issue, but for joining us today and for such a thoughtful, fascinating, and thorough discussion on the field of neurocritical care.
Thank you so much. I'm so excited for all the readers to look at our issue and learn about all of these different topics.
Again, we've been speaking with Dr. Ariane Lewis, guest editor for Continuum's most recent issue on neurocritical care. Please check it out, and thank you to our listeners for joining today.
This is Dr. Tisha May Monteith, Associate Editor of Continuum Audio. If you've enjoyed this episode, you'll love the journal, which is full of in-depth and clinically relevant information important for neurology practice. And right now, during our spring special, all subscriptions are 15% off. Go to continuumpub.com/spring2024 or use the link in the episode notes to learn more and take advantage of this great discount. This offer ends June 30th, 2024. Thank you for listening to Continuum Audio.